So I think we can classify the abnormal fetal ultrasound findings as major congenital abnormalities. Most of the time we know like what is going to happen when there is a major systemic abnormality in a fetus. And there could be minor congenital abnormalities, or in other words, soft ultrasound markers, especially soft ultrasound markers for aneuploidies like Down syndrome trisomy 21. And there is a third category where the finding is not normal, and which means it is not present in all the fetuses, but still it could be a normal variant, or sometimes it can be a transient finding which would disappear during the later part of the gestation. So we are going to focus on the soft markers, and let's see like how it is going to be important, not just in the chromosomal abnormality aspect, and what is beyond that as well. So some of these minor findings are always confusing and puts more anxiety to the parents. And there's a huge list which keeps changing now and then, now and then, based on the available evidence. And let's see what we usually follow in our clinical practice with this regards. So I always feel that it's a cakewalk for a neonatologist or a pediatrician to diagnose a Down syndrome. So the moment they look at the baby, they're going to tell that it's Down syndrome. But whereas for a fetal imaging person, it's not straightforward. And that's why we have developed a lot of ultrasound markers, the screening protocols, the maternal screening protocols from the bloods. We look at the hormones. We isolate the DNA, the fetal DNA from the mother, and we do all those kinds of tests. The essence of all these effort is to find out whether a baby has got Down syndrome and whether this can be diagnosed in the antenatal period, so that it's really going to help the family and of course the society as well. So this is a list of soft markers in the ultrasound, which we try to look at in all the second trimester fetuses. And when we see this, the moment we see this, the first thing which strikes us whether we have to evaluate this baby further to look for presence or absence, or to rule out Down syndrome. So generally, when there are two or more markers, we do recommend direct fetal testing, by which I mean that it's amniocentesis, to put a needle in the mother's womb and draw some amniotic fluid and send it for testing and to confirm whether the baby has got a Down syndrome.